So I'm going to talk very briefly about setting up a care team. There are so many differences between different states, different healthcare systems. I'm not going to be able to give a lot of specific advice, but I want to talk just sort of generally about how we think about setting up a care team and why that can be useful. So first of all, what is a care team? Pardon me. It's a team of healthcare providers and staff who provide some sort of coordinated care around a health concern, such as a connective tissue diagnosis. This is a really common way for healthcare providers to work in hospitals or places where people are, receiving long-term care or focused care for an urgent situation. This is much less common out in the real world, where people sometimes see, where people sometimes see one provider in one healthcare facility and another provider in a different healthcare facility, and those providers don't have any idea what's going on with the other specialties that the patient is working with. So I would say the most essential ingredient for a care team is that everybody on the team is communicating, however that works, whether it's between healthcare systems or within a healthcare system. And why is a care team useful? So there's all kinds of evidence that working in care teams improves patient satisfaction with their care, but it also improves provider satisfaction. People enjoy their jobs more when they're part of a team environment and there is good, efficient communication. Care teams minimize safety issues, adverse events, and they increase efficiency and quality. So there's lots of good reasons for thinking about care team as a good model for providing healthcare. And specifically, when we think about connective tissue conditions, having a care team set up before there's an urgent situation means that the team can have a plan. So if somebody has an event, who should be called first? Who's going to sort of quarterback that team? And where will the patient try to go if they have a choice about different facilities? And then how will decisions be made about what to do? So this is really useful for patients who are at risk to have complications where they may or may not be able to communicate themselves with their team. So knowing what the plan is ahead of time helps everybody be on the same page. And in addition, of course, providers can share information directly if they know they're part of a care team and they know who the other members are, so that the patient doesn't have to see one provider and then try to go and communicate what that person said to their other healthcare provider, which is a really dangerous game of telephone when patients don't have the context of training in healthcare for the most part. So who should be part of a care team? This kind of depends, but the really essential element is some sort of coordinating provider. For most people, that's their primary care provider, but it could also be anybody else that they work with on a regular basis who is accessible to the patient and is willing to provide that coordinating care, to play that role on the team. Most people have multiple specialists as part of their care team. Which specialists they need will depend on the specific connective tissue diagnosis. So somebody who has Marfan syndrome might need a slightly different set of specialists than somebody who has vascular EDS. It might depend on the patient's personal and family history. So what complications do we see in the family that we might be concerned about? And then if they have other health needs, they might have specialists who are looped in as part of that care team because maybe the patient is pregnant. You might have a different specialist depending on the age of the person or other kind of comorbid conditions. And then finally, we really think the patient and the family should be included as part of the care team so that they understand the plan, they know how decisions are made and why different things are part of the plan so that they can really help execute on the plan when they're in a situation where something happens. So here's our sort of graphic depiction of how we think about the care team. The patient is at the center. They are the most important reason for the care team being set up, but they're there in the center with that primary care provider or other coordinating provider. And that person is really the medical hub for the patient. They should know everything that's going on with all of the other specialists so that somebody is seeing the big picture. And then the patient and that coordinating provider communicate with all of the other people on the care team. So this is an example of the specialists we might talk about with somebody who has a diagnosis of vascular EDS. And as I said before, who those different providers are really depends on the situation, but it's important that they all have good lines of communication with that coordinating provider and with the patient. And then ideally, of course, all of those folks can also communicate with each other to make sure that everybody's on the same page and knows when something has happened, what's going on. The last thing I will say is that it's also important to make sure that other people who may be impacted know about your care team and know about your plan. And I know that Katie Wright is going to talk next and has far more experience and expertise in talking about emergency planning than I do. But we recommend to patients that they make sure their emergency contacts know about their care team in case the patient themselves is not able to contact that coordinating provider in an emergency. And then consider whether there's anybody else that they might want to share basic information with. So sometimes people will have a trusted colleague at work, or they'll make sure their boss has some information about their diagnosis, or just that they might be at risk for certain kinds of health conditions, so that if something happens, the people who are there who need to respond will know what to do. And then, of course, we recommend, as other speakers have mentioned, having information with you, such as a medical alert bracelet or some way that emergency personnel can figure out what's going on and get plugged into with that care team as fast as possible, so that the people who know what's happening and who have all of the context can be advising everyone about what to do. The goal of setting up a care team is really to make sure that the patient and family are supported so they don't have to do this by themselves. And that is ultimately the most important piece. And not everybody does kind of a big structured plan, and not everybody has a whole ton of specialists on their care team, but I think encouraging people to think about who is part of their team can be really useful in setting up a plan before something happens when you have to make decisions in a more emergent situation. So that's my very quick advice. I wanted to leave some time for questions if any come up. And as I said, I'm not going to have great specific suggestions for people in different locations, because things vary so much, but please do think about using your community. There are people through the Marfan Foundation, through other patient groups, it's often possible to find somebody else who has your same diagnosis in your area, and maybe they have suggestions about providers.
Great, thank you, Lauren. I do have one question for you before we move on to emergency planning with Katie. In your opinion, if you have been working on informing a group of specialists locally and have experts available out of state, how important is having a geneticist on the care team for a patient with beds? Because locally, pediatric geneticists are rare, and there's a 3-year wait to be seen just locally.
Yeah, that's a great question. And it's a problem that comes up in all kinds of locations. There are not enough geneticists. There are not enough genetic counselors. We're too small a field. I would say that geneticist is not your most important person in setting up an emergency plan. You want to make sure that the specialists you're working with are willing to learn a little bit about the condition so that they know what kinds of things to consider, but they really are already the experts on how do you deal with an aneurysm or dissection, how do you deal with a bowel rupture. So the specialists know what they're doing, whether the geneticist explains the condition to them or not. So I think, it's nice to have somebody in genetics when you can ask questions, but it's not essential to be able to set up a team and a plan.